A lot of times when a person is completed with treatments, everybody around them's like, "Oh, you're good. It's fine. Time to move on." And they're just starting to kind of embrace what the hell just happened? What did I just go through?
Did you push record?
Thank you so much for tuning back into our second act with Paige and Silka.
For your second act of life. Hi, Linda.
Hi, Paige. How are you?
I'm good.
Well, we are back on Skype this week for a very important topic, and that is for Breast Cancer Awareness Month. It's that time of year again, and all focus is on breast cancer prevention and the fight of breast cancer. Of course, what we do or what you do is look at it, again, from a higher perspective, not just the battle, the fight, the surviving cancer, but healing from it and healing healing your spirit as well. So as we started looking into this, there's a big movement now in integrative oncology that takes a lot of what you do into consideration as well. So that's kind of what we want to break that topic today and see what's new and what people want to consider if they're faced with this.
You're absolutely right. Integrative, alternative, complementary, all of those pieces fit together for anyone who's going through anything. But since we're focusing on breast cancer, absolutely, very important. And I know that we're going to have one of our resident experts that we've worked with before, Dr. Lori, and she's going to talk from the medical aspect of integrative oncology. And I bring to the table, integrative, alternative, and complementary for what I do to help with breast cancer, when you get the diagnosis, during the treatment, and most importantly, and people forget what happens after the treatment when everybody else thinks, "Oh, okay, you're done, time to move on," and that's not what it's like.
So tell us, I know you work with a lot of people that are going through cancer treatment, certainly breast cancer treatment. What is your experience and your message here?
Well, that's a loaded question, Silka. There's a lot of pieces to it. So I can tell you that, a woman gets a diagnosis and there's the initial, you have breast cancer, whichever kind that it might be. And a lot of times it doesn't hit somebody. So they go right from diagnosis to happening with doctors to what do I do next? And, like I've always said on our show, and what I do is the body holds the story. So, it keeps that trauma of first being told this is what you have, and then you have to figure out, what do I want to do? What are my treatments like? And so I'm a big proponent, and you know this, of complementary and alternative types of healing and medicine. I'm not about this or that, because what I've seen is people need an integration to really help them. So they're given the diagnosis, then they're going through whatever treatments that they get, and then comes the piece after the cancer has hopefully gone. And that's the body going, what the hell did I just go through? And a lot of times when a person is completed with treatments, everybody around them's like, "Oh, you're good. It's fine. Time to move on." And they're just starting to kind of embrace what the hell just happened? What did I just go through? They go through this emotional roller coaster. Their body goes through this emotional roller coaster as well. So there's a lot of pieces that people don't pay attention to. And you said something really important, Silka. You said, women, they're fighting it. They're going to win this battle. And every time I work with my cancer patients, I always say to them, it's great that you have this fight, but there's another piece to it. There's fighting and there's embracing. Because if you only just fight, then you're not embracing the messages that cancer is supposed to bring you. Because there's always messages that come with illness. So, and sometimes people go, "What do you mean embrace? Why do I have to embrace?"
I was just going to say, let's give an example. I obviously know what you mean, or I think I know what you mean, but I think that's an important point. Let's explain that a little bit more.
So whenever we get diagnosed with types of a disease, especially cancers, a lot of times people feel that the body has betrayed them. Like, what do you mean? What are you doing? You've gotten cancer now in me? So there's like this valve that gets, I call it, shuts off right here. So we have all the emotions that they're going on in the brain and what they have to do. And then the body is also holding the disease and all the stories and messages and gifts, possible gifts that go along with the disease. But we put a stopgap right here because a lot of my patients and clients come to me and go, I don't want to go into my body. I don't want to know about the disease. I don't want to know. Let's just fight it, move on. And I teach them that, yes, that's a vital, important part. But there's another piece. You have to open up the stop gap that's there. And you have to allow the disease to talk to you. And you have to embrace pieces of it that are going to help you heal, that are part of your themes and messages in this lifetime as well. So again, it's not this or that. There's a whole integration going on when we're diagnosed with cancer.
Well, Paige, I know you have your own integrative and complementary approach to helping people heal from breast cancer. Tell us about that.
Yeah, well, when they get the diagnosis, it's a shock. So that's traumatic right there. And there's a couple pieces that when someone gets diagnosed with breast cancer, doctors don't know what that person's gone through long before they step in front of that doctor, because most people have multiple traumas that have gone on, maybe medically, physiologically, spiritually, emotionally, mentally. So all of that is now added to the diagnosis of breast cancer. So you have all of that, the diagnosis of breast cancer, figuring out what treatments to get, finding clarity with that, and going through that. And there's many different types of alternative and complementary approaches that are out there. And I'm never someone who believes in one thing. I'm all about integration. You just can't do it all at one time because you won't know what's working, and it'll overwhelm the body when it's trying to, have that fight to deal with everything that it needs to deal with. So for me, I do many different things, as you know, Silka, but the one component that I do that's huge is every disease, even cancer, even breast cancer, has messages for you. So I teach people to go into the tumors. I teach people to go into the cancer to find out what are the messages it's holding from your lifetime. What are the messages it has to help you make choices during your treatment? And that can be choices for just about everything. And what are possible gifts that it's trying to teach you and give you, even though someone's like, how could there possibly be any gift in something happening in my breasts? So I've been doing this long enough to know that there's always messages, there's always gifts to help you as you go along in this process. And especially when the process for you has completed and you're cancer free.
Yeah, well, which is always great, but what people I think don't realize, and I'm not speaking from experience, thank the good Lord, the healing part, like what you said, is oh my God, what just happened to me?
Right.
That there's so much more to it than just the cancer itself. So people, if somebody is going through this, they can contact you directly, and
Oh,
if they
absolutely.
want to talk to you, and we'll give some of the information, or we'll give your contact information, so people who are interested in your style of healing, have the ability to do so.
Right. And let me add one thing about what you said, Silka, about when the treatments are done and hopefully you're cancer free. Family members and friends and people around you are like, great, you're good to go, let's go. And that is not the case, because the person's physical body, emotional body, spiritual body, energetic body has gone through hell. And they have to reintegrate what just happened. What did I just go through? Because many times you're on autopilot during some of this. So your body needs time to take in what happened, and you have to allow the patient who had the cancer to sit with that, to have the emotions with that, to figure out, well, what does life look like now? It's not just, okay, you're done with the treatment, time to move on, let's go. That is not what happens in disease, and especially with cancer.
Well, and I was really encouraged to see all the write-ups, or all the information on the internet about integrative oncology,
Yes.
and because it's treating them the whole body, not just the chemo,
Cancer.
the tumor, yeah. And and it was nice to hear that there isn't as much ridicule around that, and I also want to be clear that we're not suggesting alternative, that you don't do traditional. This is all your choice, whatever your treatment is. But I love the fact that the alternative is starting to be embraced in an evidence-based manner, and we'll link to some articles, and of course Dr. Lori's going to talk about that more. Is there anything else you want to add, Paige, before we close out this segment?
Just remember, and you hear me say this all the time, you have to be in touch with your knowing. And it's really hard to be in touch with your knowing when you're scared to death, but that's one of the most important times to get in touch with your knowing. So remember that people might be saying, you got to do this, 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 and this. work with somebody who can get in touch with this to help you get a little bit more clarity as you go through the process so you feel more in control. Your body feels more in control, and that whole combination is integrated during, the choices that you have to make for your treatments and afterwards as well.
And know what's best for you. Yeah, which
Yes.
is easier said than done, I'm sure. So,
Absolutely.
yeah, yeah. Paige, thank you so much. Great advice. We'll see you next time on another episode of Our Second Act with Paige and Silka.
For your second active life.
Bye bye, Paige. Thanks.
Bye, Silka.
Thanks so much for joining us today. I hope you found this information helpful. If you haven't already done so, please just take 1 second and subscribe to our channel. The button's right over here. And for more videos about living your life to the fullest after 50, just click on the link right next to me, right over here, and we'll see you next time. Bye-bye.